Hello, good afternoon. I'm Mitzi. I'm a manager in one of the dialysis center, and I'm from California Dialysis Council, and we're supposed to be here to ask to restore the 10% cut for the provider payment cut. But I would like to also touch about the topic right now, which is the in-home support services. I would like to emphasize how the dialysis center benefits from this caregiver. So if our patients needs help, and these patients would not want to go to a institution, and most of my patients doesn't want to go to institution, but if they don't have the in-home support services, I bet you their labs are up, their medications, they don't take their medication properly because they're not capable, and I bet when they come into my clinic, I'll send them to the hospital in the ER. So which is more cost effective, going to ER or having them treated in their own home, comfort of their home, which I would like to also appeal the 10% restoration for the provider, and also for their 7% restoration for their hours.
Thank you.
Hi, my name is Amy Day. I'm an elected official for United Domestic Workers out of El Dorado County. I work for both a family member and on the registry for strangers. And I just want to really thank you guys for your support today. My heart was broken when we won in September and then was told, oh, there's a freeze, and then we were told that the overtime was not going to be implemented at all. We've worked really tirelessly for this, and we deserve it. So thank you so much for your support.
Thank you.
Hi, my name's Roxanne Bender, and I'm the recording secretary for El Dorado County. And I just want to say thank you so much for taking this extremely huge step for IHSS home caregivers. We do a lot of work. We do a hard job. We get a portion of the day paid. And I just want you to know that we thank you from the bottom of our heart for taking it in the right direction. And let's continue the battle and win the war. Thank you.
Thank you.
Good afternoon. My name is Charles Caliban. I'm the Director of the Public Authority for IHSS in Alameda County. I provided you with a two-sided written statement, which I will just briefly summarize portions of. But again, I also want to express appreciation for the actions you've taken today. It's important that not only the 7% hours are restored, but SSI is provided as it should have been all of these years. I wanted also just to say that for example, the 7% cut in hours should never have happened in the first place. IHSS is not a program that you can just arbitrarily reduce, like let's decide to plant 7% less trees along the freeway this year. It doesn't work that way. IHSS hours are established by social workers who use the state's guidelines that are very detailed and specific to identify the minimum amount of hours somebody needs to remain living independently and safely. So to take any of those hours away forces people every month to ask questions of themselves like, which 7% of my work days, if they're employed, can't I get to work because I don't have anybody to get me up? Which 7% of my meals and baths and assistance with medication and personal care do I do without? Which 7% of my nights do I stay in my wheelchair because I don't have somebody to put me to bed and get me up the next morning? So these are real-life examples of the dilemmas and the choices people are forced to face when they lose any of their IHSS services. And I don't think any of us would want ourselves or our relatives, our disabled children, our elderly parents to have to make those choices in this program. So appreciate your courage and your intelligence to restore these, and let's hope we never have to request this kind of restoration again. Thank you.
Thank you.
My name is Sandra Mack. I'm with the California Alliance for Retired Americans, CARA, and I'm from San Francisco with the San Francisco CAT of CARA, and we are very much in favor of restoration of overtime. We talk about it in terms of restoration of overtime for workers on IHSS. Really, that amounts to restoration of overtime for patients. That's why CARA is involved in it. Also, the restoration of the cuts in money that was made during the hard times. Now that there is a surplus, that money should be restored without conditions because it was cut without conditions. If it was cut without conditions, it should be restored without conditions. We had a rainy day fund. For some of you may have noticed, it was raining today in Sacramento, and it's been raining not necessarily on the Delta where we could use the liquid rain, but it has been raining poverty throughout California. So we in CARA, which is a group that's composed of an alliance from various community groups and various unions and various senior groups, we are very much in support of the restoration of cuts that were made to IHSS. And although I came up on the bus, by the way, today with St. Anthony's, from which is here to talk about restoration of SSP, and you'll hear more about that later. Thank you for your attention.
Thank you. Thank you to all of our speakers. We're moving on to issue number 4, supplemental security income and the state supplementary payment. Budget and program review and advocates proposals. I'd like to call our panel forward, Mr. Lightbourne and Ms. Carroll, Ms. Kesawani, Mike Harold, and Carmela Camille. We'll have a brief overview, and then we'll take public comment after we've had the overview and questions. Ms. Carroll, if you'd like to begin.
Thank you, Chairman Thurman. I'm Eileen Carroll, Deputy Director for Adult Programs at CDSS. And there is a PowerPoint that is being distributed, sort of laying out some of the historical issues in the SSI-SSP program. But I'm going to do a very limited presentation and ask you to refer to that document for further clarification. Supplemental Security Income and State Supplemental Payment, SSI-SSP, provides a monthly cash benefit to enable the aged, blind, and disabled to meet their basic living expenses for food, clothing, and shelter. The Social Security Administration administers the program, SSP, for the state of California under a contract for a single payment. So the 2015 maximum SSI-SSP for a typical individual is $889.40. That breaks down to $733 for SSI and $156.40 for SSP. For a couple, it's slightly higher. The maximum, typical maximum, is $1,496.20. Currently, the average monthly caseload in 14-15 is 1.3 million. In 15-16, we anticipated going up slightly to 1.310 million. This is a 0.6 increase for the coming fiscal year. Total expenditures in 14-15 is $2.489 billion, and in 15-16, $2.508 billion. Again, this is SSP, so it's only state general fund money. We're not talking about the SSI share. This is an increase of 1.25% for the coming year. So when we start looking at in January of 2015, there was a 1.7% COLA by SSI, which increased benefits by $12 for an individual and $18 for a couple. So that would be, just as a reference, $877.40 went up to $889. In January of 2016, we are projecting a 1.5 COLA, again for SSI from the federal government. That would lead to an additional increase of $11 for individuals and $16 for couples. So you can anticipate in 2016 on the SSI side, combined with the existing SSP program, we're looking at payments going from $889 up to $900 for an individual. And for couples, we're looking at $1,100 going to $1,116. So some of the questions we have been asked in the past is the poverty level is associated with these increases. So just to give you some example, currently at 2015, an individual at $889 is at 91% of the poverty level. In 2016, we see that rising to 93% of the poverty level. For couples in 2015, we're looking at they're at 114% of the poverty level, And in 2016, with the increase, they will move to 115% of poverty level. So there's a slight advantage in the couple combination versus an individual. So I'm happy to stop there and move to the next panelist or answer questions.
Thank you, Ms. Carroll. And stick around. We'll have a couple questions for you. I would like to give the other panelists an opportunity to present. I see that Ms. Kesarwani is here. I don't know if there's anything that you have to present immediately, if you'd like to do so.
Yes, thank you, Mr. Chair. Rashi Kesarwani with the Legislative Analyst's Office. I believe the Sergeant has passed around a handout that we've prepared, which is an overview of SSI SSP cash grants over the last 15 years. I know Ms. Carroll has already provided you some background on SSI SSP, so I will be brief on that front. And just say that the state's general fund provides the SSP portion of the grant, while federal funds pay for the SSI portion of the grant, which is provided to low-income, aged, blind, and disabled individuals. We also note that SSI SSP recipients are ineligible for CalFresh benefits because of an arrangement known as the Supplemental Nutrition Assistance Program Cash Out Program. However, they are automatically enrolled in Medi-Cal. Moving to page 2 of our handout, we've provided sort of a display of what SSI SSP grants were in 2000, 2001, and what they are proposed to be in 2015-16, which I know Ms. Carroll has just gone over. I do want to note that the LAO chart that appears on page 14 of the agenda has incorrectly stated the grant levels that are proposed for 2015-16, and the correct grant levels do appear in the handout on page 2 in the right-hand column for the proposal for 2015-16. The federal government also provides a cost of living adjustment every January on the SSI portion of the grant. In the past, the state has also provided a cost of living adjustment based on the California Necessities Index. However, that COLA has not been provided for many years. The last state-funded COLA was provided in April 2005, and it was provided to the total SSI SSP grant. There's the possibility of providing that type of COLA. Another option is to provide a state-funded COLA to just the SSP portion of the grant. On page 3 of our handout, we provided some information on caseload and funding. In the interest of time, I'll move on to page 4, where we describe major changes that the state has undertaken related to the SSI SSP grants in order to achieve budgetary savings. One of those primary changes was to reduce the SSP portion of the grant for individuals and couples. The chart on page 4 displays this decline in the maximum SSP grant that is now provided for one of the very common categories of SSI SSP grant levels. We note that the maximum SSP grant for individuals and couples cannot be reduced any further. This is because the state is required to maintain a minimum level of the SSP grant in order to receive federal Medicaid funding. For individuals, the state reduced the grant to this minimum level in 2011-12. For couples, this occurred in 2009-10. Another budgetary change that was implemented was the suspension of the state-funded COLA. On page 5, we display in the chart that the COLA over the last 15 years was provided in 4 years. Another change that was made was that the state did not pass through the federal COLA in 2005-06. This essentially means that the state reduced the SSP portion of the grant by an amount equivalent to the federal COLA provided for the SSI portion of the grant, so that the total SSP grant remained the same despite the provision of the federal COLA. On page 6 of our handout, staff had requested that we provide sort of an accounting of what the grant levels would be had we provided COLAs since the last time they were provided in 2004-05. So conducting that calculation, we found that the grant levels would be significantly higher in 2015-16 if we had provided COLAs throughout the 10-year period. Of note is that the individual grant, the maximum grant provided to individuals would be above the federal poverty level if that had taken place, and the maximum grant for couples would be significantly above the federal poverty level. To conclude, on page 7, we have provided some options that the legislature could consider if they were interested in restoring SSI, SSP grants. These options generally fall into 2 large categories. The first option is simply increasing the SSP portion of the grant. There are a lot of different approaches for doing so. One potential approach is to focus on the grants that are provided to individuals, since their grant levels are proposed to be below the federal poverty level in 2015-16. Another option is to provide a grant increase that would be equivalent to the cumulative amount of SSP COLAs not provided since 2005-6. Obviously, this would be a significant investment by the state to provide those COLAs that weren't provided in previous years. Finally, there's the option of taking an amount of available funding and backing into an increase in the grant amounts. With more funding available, the grants could be increased by a greater amount. And finally, in the second option, we note that you could provide a state-funded COLA going forward. For 2015-16, we estimate that a COLA provided to the SSP portion of the grant would be about $40 million general fund, assuming January 1st implementation. And the department reports that a state-funded COLA provided to the total SSI SSP grant would cost about $120 million general fund, again, assuming January implementation. And we'd like to note that as you continue to provide a COLA in out years, the cost of the COLA would grow because it would be cumulative year over year. Thank you.
Thank you. Mr. Harrell?
Thank you, Mr. Chair. Mike Harrell with the Western Center on Law and Poverty. I'm listed as Californians for SSI here. I appreciate the staff listing me that way because we are participating in this coalition. It's a new coalition that's formed from throughout the state of California. There'll be people here from the coalition also testifying in public time. So I just want to make a few introductory comments, and then I'm going to let my witness do most of her talking. But the one thing I would just like to paint a picture for you, I know, just had a lengthy hearing on in-home supportive services, and rightfully so. And about 85% of folks on IHSS receive as their principal source of income SSI. So there's a tremendous overlap between these two populations. It's appropriate that they're heard together. There have been significant cuts to IHSS over time. There have also been cuts to this population over time to the Medi-Cal program. And then lastly, the same population, as the LAO just described, has taken significant cuts to their SSI grant. So this is a population that has been asked to make sacrifices in the state budget during the hardest times over and over and over again. And I'm probably forgetting some of the cuts that occurred during that time period. So it's important that the committee and members here keep in mind that the SSI population, however, unlike the other two that I previously mentioned, have had none of their cuts restored yet. And we're hoping that this committee and the Senate can begin to address that and reverse that trend this year. The one thing I would say, I appreciate the LAOs laying out the variety of options for you, and there certainly are some. But we're here today with a fairly simple request. We would like to get on the path of restoring the money that has been cut from grants, the actual grant amounts, and we believe that the legislature should reverse the action that it took in 2009 to repeal the statutory cost of living adjustment, which had existed for decades in the program that applied to the entire grant. And our recommendation to you would be that we would simply restore the previous language from the statute that was repealed back in 2009 and make that active going forward. Always, of course, subject to a budget appropriation in each budget year. And so with those introductory comments, I would like to introduce to you Camille. She's an SSI recipient with St. Anthony's in San Francisco, and I'm now going to allow her to tell you a little bit about her story.
Hello, my name's Carmela Camille, and a 49-year-old Native American who's a California Indian that's been residing in San Francisco because I choose to be an urban Indian. And San Francisco is the most expensive city in America. And my income right now, my rent is 85% of my income, and everything from bills to basic necessities like food and toiletries. It's an ongoing juggle to suffice independently on this income that I have. And I have like my St. Anthony's card to go eat if I need to, if there's no food. So I do like try to supplement with alternative things available in the community. But that's another conversation in our community. But what I like to say is that with the ongoing increase in cost of living in San Francisco and where Social Security is at, it causes serious displacement of housing for like single women like me, puts us in really bad neighborhoods, not just the TL. I live on 6th Street, marginally south of Market, and you know, there's slumlords. The rules don't reflect what they ask for you when you come in on your rental application. It becomes a very treacherous situation, you know, where the fact that it's not handled professionally, I'm afraid to bring loved ones there because identity theft is on the rise. And I can't allow my loved ones to be getting robbed by a faulty living situation. So being financially, it puts me in displacement housing. And I would like to live in a safe place where I didn't have to run away from everybody.
Thank you, Ms. Camille. The committee appreciates you being here and sharing your testimony. And, you know, if you stick around, we may have a few questions for you, but we appreciate anything else that you wish to share. Thank you. Thank you. Anything from finance? Okay. So my introduction to SSI and SSP came in my work as a social worker at a regional center in San Francisco, and in the East Bay in Oakland. And I was always amazed at, as Ms. Camille stated, how little SSI, SSP paid for, especially when you consider the high rents of the Bay Area or other urban centers. And so for the life of me, I cannot understand several things, but one was why anyone who's getting SSI, SSP is not eligible for CalFresh. I just didn't understand it. And I heard the, don't clap. You're going to get me in trouble if you clap. If you clap, the sergeant's going to throw me out. So, and if you could take me through it again, this is by statute in California, federally, or, you know, and what do we need to do to change it? I just don't get it.
Well, I think a lot of people struggle with that piece of the puzzle. But the bottom line is when they originally structured all these elements, they included what was food stamps, now CalFresh, into the grant for SSI, SSP. At the time they had evaluated it, it was roughly $10 at this point. This arrangement is authorized in the federal law, and it's part of what the Supplemental Nutrition Assistance Program Cash Out program requires. And this has been going on since 1975. Today, CalFresh benefit is 100% federally funded. However, the administration costs are shared by the state. Ending the cash out would allow recipients to apply for CalFresh. However, the SSSP payment would be reduced if California cashed out. Unfortunately, we're at the 1983 MOE level. So one of the aspects is we can't go any lower in payments, so you couldn't reduce the benefit to allow them to break out. The other problem is there's been various years where you look at data, And about a third of the program would suffer if we move out of this arrangement. And the rest of the program would benefit. And that's been one of the struggles is if we move in this direction, we have to get off the MOE and we'd have to make a decision because it's an all or nothing. So once you move down that road, you're going to be making a change that will impact negatively at least a third of the program, and it depends on what year we run the data.
I appreciate the context, and I want to be clear. It is not my intent to reduce the amount, the net amount that anyone receives. It's really my acknowledging what we all know, right? You said in your presentation that many of the recipients are at 100% of the poverty levels, and in some cases, even more disastrous levels, that a person can't manage on what is provided right now for SSI, SSP. And so, but understanding that this is a federal requirement and that there will be disastrous results to consequences, yes, thank you, for making those changes. I do want to ask, what is the governor's plans for increasing the amount of the benefit? Because I agree with you. I don't want to see the benefit be any lower, and it's pretty low and hard to live on. It's pretty clear. What is the plan for increasing the benefits moving forward?
At this point, I could tell you that the governor's budget doesn't reflect an increase to the SSSP payment, but we acknowledge that it's one of many other competing budget priorities that need to be discussed.
Understood. Not directed to you, but not good enough. It is a priority. It is a priority. And so I am asking that you share that as you go forward in your meetings and your conversations, that this is a priority, and that I intend that to be a regular part of the conversation of this committee, that we've got to be able to support all Californians, and especially those who have some of the greatest need. Okay. Ms. Camille, did you have anything else that you wanted to add today?
I'm just grateful you guys took the time to listen to me. Thank you.
Thank you. Assemblymember Grove, did you have anything that you wanted to add or any questions?
No, I guess I would just be a little bit more, my colleague, the chair, is very polite. So my question is why? Why isn't it a priority? Why?
Well, I don't think the administration doesn't believe it's a priority. It just was not put into the budget due to other activities that were already budgeted.
Why were other things put in the budget and not this? Were other things, they must have been a priority.
Well, I think some of the other priorities, and I'm not the person who can speak to the entire budget. Maybe the Department of Finance wants to reflect on that. But I can tell you from IHSS, restoration of the 7% was a considerable priority.
Okay.
Finance, was there anything?
Sorry, Brandon Nunes with Finance, and I would just echo what the department says. I mean, if we were to provide COLAs in this particular area, as LAO pointed out, I think it was $40 million for a half year and 120 full year, depending on how you applied it. Annualized, you roughly double that, and so it does provide competing priorities within other state programs where you'd have to make decisions to make cuts in those areas, and we would have to weigh that on a statewide basis. So.
I can't put it any more, I can't say it in a more articulate way than Ms. Camille said it. We should never, ever ask Californians to have to choose between paying rent and eating, and when all you can afford to do is pay rent and then eat in the local shelter. It's unacceptable. And to the statement that because the 7% restoration is being pursued, to me, this is not mutually exclusive. We needed to do both, you know, the 7% restoration and make sure that we provide the best that we can for those who qualify for SSI, SSP. So that's my message, and I want to hear from the public. Thank you, presenters. Public comment on this issue, 1 minute to each speaker.
I got a background in audio production too. Thank you. Joseph Berry, representing Disability Organizing Group for Initiating Total Equality. And I just want to echo what Mr. Thurman said, and that is that unfortunately, whether it's a cut with our IHSS hours or a cut with our Social Security monies, we are having to make tough decisions, whether that's to, eat top ramens for 2 days in order to have, hygiene needs met, or, whether, like you said, you're gonna eat or you're gonna, pay the whole power bill. Those things are realities that I would argue all of us have faced within the last 6 months. It's kind of a slap in the face when the governor says that we're saving for a rainy day fund, and we've had a rainy day going since the whole economy tanked out, and we were asked to make the cuts just like everyone else. You didn't hear a lot of complaints from us, but the bottom line is, especially the Social Security part not being restored at all, we're having a rainy day consistently, constantly, and so this rainy day fund should be applied ethically and appropriately to those who've been most patient with getting what they're due. Thank you.
Thank you.